we'll get started. Thanks everyone for joining us. I'm Ryan Spiteri, the Communications Manager here at the Brant County Health Unit. Here with me I have Dr. Rebecca Comley, Acting Medical Officer of Health at BCHU, and Dr. Joanne Tober, BCHU CEO. Before we get started, can we do a quick roll call for those joining us? I'll just have you state your name and your affiliation.
Michelle Ruby from the Brantford Expositors.
Patty Berardi, Rogers TV.
Thank you. In a moment, I'll turn it over to Dr. Comley to make a brief statement. This will be followed by a question and answer period where questions regarding COVID-19 case trends, case and contact management, etc., can be directed at Dr. Comley, and questions regarding vaccines can be directed at Joanne. At this point, if you could put your phone on mute if you're able to, we'd appreciate it, and we'll now turn it over to Dr. Comley.
Thank you all for joining us. Last week, there were 59 cases of COVID-19 locally. Our case counts have remained steady around this mark for the last month. We're continuing to see a majority of local cases in the younger age bracket. Last week, 73% of the cases were those in under 40 years of age, and 29% of those were in younger than 20. Schools have now been in session for a full 2-week incubation period. So this means the amount of cases we are seeing now should be a baseline for what we can expect in terms of school cases and outbreaks in the near future. While there are reasons to be optimistic about what is to come, we need to continue to follow all the public health guidelines in order to see improvements. This means staying home when you're even mildly ill and seeking assessment and testing, as well as continuing to wear face coverings in applicable settings. Again, I know many of us feel done with COVID, but unfortunately, COVID is not done with us yet. I'd like to thank our applicable local businesses and organizations for helping to support the rollout of the province's Proof of Vaccine program. The health unit received 3 complaints regarding businesses not enforcing the new guidelines last week, and the health unit enforcement staff visited these establishments to provide education on their duty to enforce the program. All 3 establishments will be revisited this week to ensure compliance is being maintained. I'd like to remind our residents to show patience and kindness to those who are working in these settings. These employees are going above and beyond their normal duties to ensure their patrons are remaining safe. They should be applauded for their efforts they are making to help protect our community. As of Sunday, 80% of Brant residents 12 years and older have received at least 1 dose of COVID-19 vaccine, and 75% have completed the series. This week, we are holding PopUp Clinics at high schools in our community. The schedule for these clinics is available on our website. I would urge all parents with children who are eligible to take advantage of these clinics and have their child receive a vaccine if they have not yet done so. We also continue to operate walk-in clinics at a variety of different locations across Brant. Our walk-in pop-up clinic schedule can be found on our website. Our on-site staff at all our clinics are available to answer any questions about the COVID-19 vaccine and help to provide support to those who have a fear of needles. For those who need a little extra time, we recommend booking an appointment to ensure our staff have enough time to meet your needs.
Thank you, Dr. Comley. We'll now open things up for questions.
It's Michelle from the Expositor. I wanted to ask about what, if there are plans in place or if you're gearing up for vaccines for children under 12. What is the health unit? I know that there's still approvals needed, but are you doing something to gear up for the potential to give vaccines to younger children?
Hi, Michelle. Yes, absolutely. We've been planning for this for a while and are now finalizing things, and we're just waiting for the ministry information and the go-ahead and the availability of the vaccine, and we will be opening clinics immediately for those age groups.
Okay. I also wanted to ask if there have been any cases, COVID cases, traced back to the Paris Fair, which was held on Labor Day weekend.
I know there were no cases traced back to the Paris Fair.
Okay. I think those are the questions I had. Thank you.
Thanks.
It's Patty from Rogers. In terms of vaccination, I'm curious as to what your thoughts are on the fact that we don't have the COVID-19 vaccination as a mandatory vaccine for school. However, school boards renting out facilities like gymnasiums to places like CYO are requiring proof of vaccination. I don't understand the difference between a child in the school in the gymnasium unvaccinated compared to a child in a league who's vaccinated. There seems to be a bit of a confusion among parents as to why that is the case.
There would be those would be different scenarios to people coming into a sporting event and the requirements under the ministry guidance about the requiring vaccination to attend certain events. So when visitors or external people are attending events, that would be different than a school activity and a school gym class.
Is there a feeling among public health that this should be a mandatory vaccination, at least for children that are able to get it now?
We would absolutely support policies from the provincial guidance around those types of issues. So we would be supportive of that.
And I just have one other question. Is there availability to do testing? I know that last year we started to see testing clinics that were sort of random in different schools. Any thoughts about doing that again this year?
Yeah, at this point in time, the health unit is not involved in any testing. There is some pilot testing going on in schools, but there are none in our area.